and welcome to this SADA webinar for the public. We are honored to have Dr. Eubulus Timothy discussing me and my dental phobia. I would like to introduce our speaker for today. Dr. Eubulus Timothy is a dental surgeon, educator, mentor, award-winning filmmaker, provocateur, disruptor, and auteur. He qualified as a dental surgeon at Manipal University and has 2 postgraduate diplomas, one in implantology and another in aesthetics, both from the University of the Western Cape. He lectures in postgraduate program at the University of Western Cape. Eubulus is a renowned international lecturer, motivational speaker, and facilitator. In Hollywood, he won the prestigious Harley Merrill Screenwriting Award, was the founding chair of the Cape Film Commission, served 3 terms as vice chairperson of the Writers Guild of South Africa, and is presently the treasurer. He recently wrote and directed the highly acclaimed feature, Deep End, winning Best Picture and Best Director, Best Screenplay. He produced Cape Night Live, which introduced Mark Lottering to South African television audiences. He wrote, directed, and produced the first ever live broadcast from Robben Island in 1999 for ETV called Bridging the Gap. During this lockdown, he directed Vivaldi's 4-season Spring in the Time of COVID-19, of how music lives on even when the artist dies. It won Best Artistic Film at the eThekwini Filmmakers Award. It was nominated for a Simon Sabela 2021 Bokeh Fashion Film Awards and Durban Tourism Awards. Without any further ado, I'm going to hand you over now to the presenter for today's program, Dr. Eubulus Timothy.
Thank you so much for those kind words, Dr. Osmond. I appreciate it. It was quite a lot. I'm sorry. I do apologize. And hello, everybody. Thank you for joining us at SADA. And when we talk about me and the dental chair phobia, as you may see, and I'm going to pull my chair up so you can see I'm actually sitting in my dental chair so that you actually have an idea where I am. And I wanted you to know that for me, this might be a safe place. And I think a lot of doctors will tell you, dentists will tell you, sometimes when we want to take a break, we sit on our dental chair and we relax on it. And this is our place of work. However, so many of us, and I guess sometimes, when we have to come for treatment, we too, as dentists, also still have a little bit of apprehension. A lot of us, and I would say most doctors will say 1 in every 5 patients have some sort of fear about the dental chair. As soon as they see it, oh, doctor, it's not you, but I just can't stand the chair. Or doctor, I just hate dentists. And all the dentists will tell you they've heard this over and over and over. And this is real. And we have to accept it as being real. But it is something that we are now learning more and more about. This is not psychological, but this is neurological. And we are finding out normally this fear, and fear is something that helps us, protects us. Like stress, it protects us, it keeps us alive, but we need to manage it. Unfortunately, when it comes to fear of the dental chair, that fear cannot be managed. That fear cannot be extinct. And why does that happen? It's normally because some sort of trauma in the past. A lot of the times, it's that very first experience at the dentist was not what we thought it would be. Our mom and dad told us that we're going to the dentist and, don't worry, we'll give you candy. And you were more concentrating on the lollipop, and suddenly you get this huge needle coming straight into your eyes, into your face, and disappears into your mouth. And then suddenly you lose control of your mouth. And as a child, this is so important psychologically and neurologically, because this is the one part that we communicate with as children. And we seem to have lost control of that. And then before you know it, a part of you is ripped out, a tooth is taken out. And then there's blood. And it's coming from your mouth. And you have to appreciated from a child's point of view. And a lot of the time, a lot of adults who did not get a chance to go to dentists when they were younger also have the same experience. So a lot of the time, the phobia, the fear that people have, and even dentists have of dentists, of the dental chair, is coming from a point of fear and inability for us to extinct that fear. We need to extinct that fear because this is how we survive. You will see grown men shrivel in the dental chair. You see powerful women sort of back down and tear. And of course, you know, the kids, we deal with them, they've had bad experiences and they'll cry. Or what is even worse, they are told that they're going to the dentist and they share that information with their friends, and their friends say, oh, don't go. This happened to me and that happened to me. So it is by reference. Again, the fear of the dental chair. Then there is one more that we tend to have overlooked, and that is trauma that's outside the experience of the dental chair. And we are now learning to understand more and more what we call complex PTSD or childhood trauma. Here again, it is trauma that happened to children, even as babies, even in few months or few days old. If they have been neglected, normally when the parents are drug addicts or alcoholics, or they have been sent away, or they've been abandoned. Abandonment is a huge thing, is that a lot of the time in the old days, if a mother could not handle the child, mainly because of postpartum depression. We didn't understand it in those days. What would happen if the child is then sent to a grandmother or an auntie or somebody else, even if it's for just a few days? And we now know, because of studying twins, one is kept and the others are sent. The one that was sent will suffer from complex PTSD. And of course, there's violence. We know that sexual violence, or you watch it or you experience it, and then there's abusive violence where you're being abused physically or just verbally. These things affect a person, and this is complex PTSD, which then is carried on into teenage years, into marriages, to find there's problems with the marriages and things like that. And then when it comes to the dentist, this is another place where they do not have control. And this is one place where you do not have control. So we know now a lot about what happens, but how do we manage it? And this is the most important thing. First and foremost, if you have any apprehensions about visiting the dentist, please understand that you have to, because you need your smile. You know, they always say, only floss the teeth you need. And that makes you think, doesn't it? We need all our teeth. So that's important. So you need to visit the dentist. And people would not come. And a lot of the time we saw during COVID, they will come too late, meaning what could have been just a filling is now a root canal or an extraction, because it's too late. If your mouth is sensitive, it means your body is telling you there's a problem. If there's pain in your mouth, most dentists will tell you it's too late because already the nerve is involved. So communicate to your dentist that, doctor, I have a problem, well before you make you attend. And when you do come in, also share that. Secondly, get support. Now, this might seem a bit weird, but if you have somebody that you could bring along with you as support for you. Another thing that we find out is to breathe. Take deep breaths. And you can tell that to your dentist and ask your dentist to explain every step. Fourthly, is that take small breaks. And then, you know, most of us will tell you, if you need to take a break, lift your hand up, do so. Then we use what we call distraction. Distraction is that sometimes there's a big TV on the top and you're watching programs. We suggest you bring your earphones and you listen to your own music, or you ask the doctor to put the radio on or to play some music. Most practices have music being played. Sometimes you may not like the music. So you say, doctor, I don't quite like that music. Please, do you mind? And we will, because we do understand. We do understand what you're going through. And it might seem a silly thing is, oh, you know, If you don't like the music, it's fine. In my practice, it doesn't look like a normal practice. It looks like a living room. We have paintings and pictures and all this sort of stuff, and we have couches. And in my actual surgery as well, I have paintings and my movie posters and all wonderful things. And so that you feel that you are in a place that is not what you normally used to. The other thing is that you have got to learn to manage your stress. This is a huge thing that I'm finding more and more with my patients. Again, I say 1 in every 5 patients have fear of the dentist. I would say 2 in every 5 have some sort of bruxism, and that is stress-driven. So I suggest to you that learn to manage your stress. And how do you do that? Is that first and foremost is that you make time for yourself. So many times, talking to my patients, they will start crying because they do not make time for themselves. They're so busy caught up at work. They're so busy caught up at home with their family, with their friends. They do not have time for themselves. And it's important that you make time for yourself. I suggest for those who suffer from bruxism, we treat them in a very specific way. But the most important thing is that we tell them to make sure that they find exercise. And we suggest that they do Pilates, reformer Pilates, which help them change the way they stand, breathe. It all helps you in the way you are. Surround yourself with music. Surround yourself with art. Go to the museums. Listen to music. Take time for yourself. Just be in a good space. Swim if you can. Learn to play an instrument. Learn to play an instrument or go paint. Do something creative. We are the only species in the known universe that has the ability to create purely for the fun of it. And, birds may make beautiful nests, but they do it because of necessity, and they do not take pictures of it and send it to their friends to say, look what I've done. Whereas we do. We make art, we make music, we make beauty, we make architecture because we can. We make science. Look at all the stuff that we've done at science. Look at all the stuff we've done with technology. I am now sitting in Durban and I'm reaching out to the rest of South Africa and the world. We have an amazing mind, and let us use it to overcome our fears. It's so important that our fears are overcome, starting with the dentist. Give your dentist a hug when you walk. Give him her a hug. They're there to serve you. And we dentists manage your pain. Not only do we manage your pain and your fear and your expectations, we also feel it. We really absorb what you say to us, and it does affect us. And remember, when you're sitting on the dental chair, your head is on our lap, literally on our lap. And we are so close to you that no other professional, healthcare professional is so close, except maybe a dermatologist looking at your skin. We are up close and personal in your space. And that also interferes in the way you feel, especially if you're a child with trauma. So you say, doctor, can I take a break? Doctor, please explain to me what you're going to do next. And all doctors will appreciate that. And again, if you are stressed and you need to take a break, lift your hand up. And I think that answers a lot of the questions. Doctor?
Thank you so much, Dr. Timothy. What a wonderful, insightful presentation. And yes, I do agree that patients need to understand that we as dentists are not the enemy. We are there to help them, guide them, and explain to them. I think also one must realize that times have changed, equipment has changed, the advances in technology, and all the things that people had the biggest or the worst experiences in the olden days. Technology has caught up and exceeded and eliminated a lot of the pain, a lot of the anxiety that can result in the procedure. Yes, we do acknowledge some people have a serious inhibition, a serious fear of going to the dentist, and those can be managed with patience and understanding. There are tools that we can use, conscious sedation, medication, pre-medication for anxiety relief. And dentists are more than willing to explore every opportunity as long as it's safe and effective in allowing one to attend the dental visit. Another thing, most times people only end up going to the dentist when it's already in a pain or a almost unsalvageable position. And we have to work miracles, which we do, but sometimes the longer you take, there will be a little bit of pain associated to get you back to health. So from my side, I would encourage the public, be regular with your checkups in a non-combative, non-painful way. Do a cleaning. Yes, a cleaning may be sensitive from time to time, but the benefit from a cleaning can pick up a problem earlier. Prevention is much more a better way of healthcare than curative. And that is what we as dentists encompass and try to achieve. Do a regular checkup, pick up the problem before it becomes a major issue. Firstly, it will be much more economically sound to do a preventative exercise instead of a reparative where you have to go into doing now crowns after doing a root canal. So prevention is the key. But Dr. Timothy, I really applaud the work that you've done, and you can see you are very passionate about what you do. And I really encourage all the members of the public to go visit their dentist, have that sit down, have a discussion, speak to your dentist. I mean, if we had to ask every single dentist, the first words that come out of the patient's mouth, I hate going to the dentist. I hate you guys. So spare thought for us as well. I mean, we understand we are not the best, well-liked health professionals, but we're there to care, and we really want to make sure that you have pain-free smiles that express your joy. I'd like to thank everyone for attending today's webinar for the public by SADA. I'd like to thank Dr. Eubulus Timothy for taking time out of his busy day to present to us, and we look forward to seeing you in our member dentist chairs sooner rather than later. Thank you very much. Goodbye.
Thank you. Thank you. Bye.
Thank you so much. Bye.